Which cytochrome enzyme is implicated as a tobacco inducer when an individual is treated on clozapine? A. 1A2. B. 2D6. C. 2C9. D. 2C19. The correct answer is A. 1A2. When an individual is treated on clozapine and decreases tobacco use, the clozapine level will increase, as the tobacco is an inducer to the clozapine, and the patient no longer needs the higher dose of clozapine. As a psychiatric mental health nurse practitioner, you are aware of antipsychotic medication side effects. Which of the following side effects of antipsychotic medications has an insidious, delayed onset, typically 1 to 2 years after initiation of the medication? A. Tardive dyskinesia. B. Sedation. C. Weight gain. D. Dry mouth. The correct answer is A. Tardive dyskinesia. Tardive dyskinesia, TD, is a delayed-onset involuntary movement disorder associated with antipsychotic medications. A typical clinical course of TD is marked by insidious onset, usually after 1 to 2 years of continuous exposure to antipsychotics. A 24-year-old mother of a 2-year-old child presents to the clinic. Which of the following facial characteristics would lead the psychiatric mental health nurse practitioner to believe the child has fetal alcohol syndrome? A. High nasal bridge, plump mid-face, and large eyelid opening. B. Large head, thick upper lip, and overdeveloped jaw. C. Long nose, large eyelid opening, and developed philtrum. D. Small head, thin upper lip, and smooth philtrum. The correct answer is D. Small head, thin upper lip, and smooth philtrum. Children with fetal alcohol syndrome have distinct facial characteristics that can be assessed on examination: small head, short eyelid opening, flat mid-face, smooth philtrum, underdeveloped jaw, thin upper lip, and short nose. While treating a 12-year-old boy for ADHD, the psychiatric mental health nurse practitioner observes which of the following physical features that raise concerns for genetic evaluation for Fragile X syndrome. A. Small head, short palpebral fissure, inner epicanthal folds. B. Obesity, small stature, small hands and feet, hypotonia. C. Café au lait spots on face and arms, neurofibromas. D. Long head and ears, short stature, hyperextensible joints. The correct answer is D. Long head and ears, short stature, hyperextensible joints. Etiological factors in mental retardation can be genetic, developmental, acquired, or a combination. Fragile X syndrome is a genetic disorder with characteristic physical features that warrant genetic testing for confirmation. A client is suffering from schizophrenia. Which of the following would be the appropriate question for the psychiatric mental health nurse practitioner to ask when assessing side effects produced by dopamine antagonism in the tuberoinfundibular pathway? A. Are you experiencing drooling? B. Are you experiencing dizziness? C. Are you experiencing breast discharge? D. Are you experiencing tremors? The correct answer is C. Are you experiencing breast discharge? Galactorrhea is caused from dopamine blockade in the tuberoinfundibular pathway by antipsychotic drugs. Which of the following statements regarding disulfiram, antabuse, is correct? A. Disulfiram should not be taken for at least 6 hours after drinking alcohol. B. Avoid anything containing alcohol, for example, vinegar, mouthwash, aftershave, cough medication, while using disulfiram and for 2 weeks after discontinuing. C. Disulfiram can lower liver function tests, so monitoring is necessary. D. A disulfiram alcohol reaction can occur up to a week after discontinuing disulfiram. The correct answer is B. Avoid anything containing alcohol, for example, vinegar, mouthwash, aftershave, cough medication, while using disulfiram and for 2 weeks after discontinuing. Disulfiram should not be taken for at least 12 hours after drinking alcohol, as a disulfiram alcohol reaction can occur up to 2 weeks after discontinuing it. Arcus senilis, when seen before the age of 40 years, is associated with which of the following disorders? A. HIV infection. B. Hyperlipidemia. C. Hypertension. D. Syphilis. The correct answer is B. Hyperlipidemia. Arcus senilis is a gray opaque band in the cornea, 1 to 1.5 mm wide, separated from the limbus by a narrow clear zone. Early on only a segment of the circumference is involved, later the circle is completed. It is present to some degree in most persons older than 60 years of age. It is bilateral. If seen before age 40, hyperlipidemia should be suspected. Which mood stabilizer is most associated with a potentially life-threatening rash? A. Lamotrigine, Lamictal. B. Carbamazepine, Tegretol. C. Lithium, Escalith. D. Valproex, Depakote. The correct answer is A. Lamotrigine, Lamictal. Lamotrigine is associated with a rare, serious, and potentially life-threatening rash. For a patient who has a long history of opiate dependence and is newly in recovery, which of the following is most likely to aid in the treatment process? A. Bupropion, Wellbutrin. B. Buprenorphine, Buprenex. C. Varenicline, Chantix. D. Acamprosate, Camprol. The correct answer is B. Buprenorphine, Buprenex. Buprenorphine is indicated for treatment of opioid dependence. Augmentation with behavioral, educational, and/or supportive therapy in groups or as individuals is probably key to successful treatment. Which of the following findings would raise concern in an annual exam of a 76-year-old woman? A. Fasting glucose 76 mg per deciliter, Hg 11.8 mg per deciliter, HCT 38%. B. Height 65 inches, weight 140 pounds. C. Blood pressure 130/86, pulse 82, respirations 25. D. AST 85 units per liter, ALT 45 units per liter. The correct answer is D. AST 85 units per liter, ALT 45 units per liter. Height, weight, calculated BMI of 23, all vital signs, glucose, hemoglobin and hematocrit are within normal limits for 76-year-old woman. The AST is elevated, normal range 5 to 40 units per liter of serum, and ALT is normal, range 7 to 56 units per liter of serum. When AST greater than ALT, one suspects chronic liver disease or recent post-myocardial infarction. Further assessment is warranted, including rule out of alcohol dependence. A WBC of 4,000 in a patient taking clozapine would prompt the psychiatric mental health nurse practitioner to take which of the following actions? A. Institute daily complete blood count with differentials and monitor closely. B. Institute twice weekly complete blood count with differentials and monitor closely. C. Consult with hematologist to determine appropriate antibiotic regimen and monitor closely. D. Discontinue clozapine, initiate alternative antipsychotic medication and monitor closely. The correct answer is B. Institute twice weekly complete blood count with differentials and monitor closely. The recommended cut points for discontinuation of clozapine are WBC of 2,000 to 3,000 or granulocytes of 1,000 to 1,500 for agranulocytosis and severely compromised immune system. At a WBC of 4,000, the recommendation is to closely monitor CBC with differential twice a week, while patient may continue clozapine in the absence of any other signs or symptoms. A middle school boy repeatedly lies, steals, bullies peers, instigates fights, and inflicts harm without feeling any regret or remorse. These are characteristics of which disorder? A. Antisocial personality disorder. B. Oppositional defiant disorder. C. Conduct disorder. D. Disruptive behavior disorder. The correct answer is C. Conduct disorder. Conduct disorder is a childhood disorder characterized by serious violations of social norms, including aggressive behavior, destruction of property and cruelty to animals. These children often lie to achieve short-term ends, may be truant from school, run away from home, and may engage in petty larceny. A patient with a diagnosis of schizophrenia has a history of suicidal ideation and suicide attempts. The psychiatric mental health nurse practitioner should consider which antipsychotic medication that is the only known antipsychotic to reduce the risk of suicide in schizophrenia. A. Abilify, aripiprazole. B. Latuda, lurasidone. C. Invega, iloperidone. D. Clozaril, clozapine. The correct answer is D. Clozaril, clozapine. Clozaril, clozapine, is the only known antipsychotic medication that has been shown to reduce the risk of suicide in patients diagnosed with schizophrenia. A pervasive pattern of grandiosity, lack of empathy, and need for admiration suggests the diagnosis of which of the following personality disorders? A. Narcissistic. B. Paranoid. C. Schizotypal. D. Borderline. The correct answer is A. Narcissistic. The essential features of narcissistic personality disorder is a pervasive pattern of grandiosity, need for admiration, and lack of empathy that begins by early adulthood and is present in a variety of contexts. What is a rare but serious side effect of trazodone, deserel? A. Rash. B. Confusion. C. Priapism. D. Tremor. The correct answer is C. Priapism. Painful persisting penile erection, priapism, is a rare but serious side effect which can occur with trazodone. The risk of bleeding on selective serotonin reuptake inhibitors, nonsteroidal anti-inflammatory drugs, or aspirin, is an example of which of the following principles? A. Pharmacodynamic. B. Distribution. C. Absorption. D. Pharmacokinetic. The correct answer is A. Pharmacodynamic. Interaction is due to the risk of inhibition of platelet aggregation, an example of pharmacodynamics. You are on call for your service. You arrive at the emergency department to find a 22-year-old male patient complaining of having trouble with his eyes. His vitals are stable. He is 5 foot 7 inches tall, his weight is 140 pounds, and his labs are all in the normal range. He states that he has been taking aripiprazole, Abilify, for the last 2 months for his bipolar I disorder. He had the dose raised to 15 milligrams orally every morning 4 days ago to manage a manic episode. He states that 1 to 3 times a day for the past 2 days his eyes will roll upwards for 10 to 15 minutes and he will have trouble seeing until they roll back down. When you examine his eyes, he is able to fully open his eyes, but he is not able to focus his eyes on you. His eyes are rolled upwards about 2/3 of the way towards his upper eyelid. After examination you decide to A. Discontinue the aripiprazole and give benztropine mesylate, Cogentin, 1 mg. Have him take benztropine mesylate 1 mg orally twice a day for 5 days. Have him return to his provider for a different medication for his bipolar disorder the next day. B. Discontinue the aripiprazole and begin the patient on a gradually increasing regimen of lamotrigine 25 mg 1 orally at bedtime for 1 week. Have him return to his provider for further management of his bipolar disorder. C. Continue the aripiprazole and give benztropine mesylate, Cogentin, 1 mg. Have him take benztropine mesylate, Cogentin, 1 mg orally twice a day. Have him return to his provider for further management of his bipolar disorder the next day. D. Begin a cross-titration downward of the aripiprazole and upwards of haloperidol, Haldol. Have him return to his provider for further management of his bipolar disorder. The correct answer is A. Discontinue the aripiprazole and give benztropine mesylate, Cogentin, 1 mg. Have him take benztropine mesylate 1 mg orally twice a day for 5 days. Have him return to his provider for a different medication for his bipolar disorder the next day. This is an aripiprazole-induced oculogeric crisis, acute dystonia, for example, muscle spasms and contractions that can cause strange posturing of the body depending on the muscle groups affected. This is not as common with atypical antipsychotic medications as with the older antipsychotic medications. Aripiprazole has a half-life of 75 hours. Aripiprazole is the third-generation atypical antipsychotic and a dopamine-serotonin system stabilizer, DSS, that is effective against positive and negative symptoms of schizophrenia. A 37-year-old patient with schizophrenia is started on a high dose of chlorpromazine, Thorazine. The next day, he complains of lightheadedness after standing up. Vital sign changes reflect a significant decrease in blood pressure and an increase in heart rate. You suspect this is secondary to the alpha-1 adrenergic blockade which is causing A. Orthostatic hypotension. B. Dry mouth. C. Respiratory depression. D. Decreased sweating. The correct answer is A. Orthostatic hypotension. Orthostatic hypotension, a drop in blood pressure while standing, is a side effect from alpha-1 adrenergic blockade. This is especially troublesome with chlorpromazine and clozapine and is best handled by raising doses slowly. When assessing an elderly patient who complains of tinnitus, The psychiatric mental health nurse practitioner would associate which of the following findings with an acoustic neuroma? A. Suppuration of the labyrinth. B. Unilateral ringing in ear. C. Inflammation of middle ear. D. Perforation of tympanic membrane. The correct answer is B. Unilateral ringing in ear. Unilateral tinnitus, ringing in the ears, may be the first symptom of an acoustic neuroma. The other three responses are associated with infection of the middle or inner ear and not associated with acoustic neuroma. Which of the following statements reflects current understanding of neurodevelopment and best explains risk-taking behaviors of adolescent males? A. Hormonal flooding, especially testosterone and oxytocin, increase dopamine levels in the brain. B. Stimulant and substance use impairs judgment and cognitive appraisal. C. Maturation of the prefrontal cortex continues into mid-20s and early 30s. D. Pruning of serotonin circuits in the adolescent brain is associated with increased impulsivity. The correct answer is C. Maturation of the prefrontal cortex continues into mid-20s and early 30s. The prefrontal cortex acts to inhibit impulsive and motivational drives, yet this structure doesn't fully mature until the mid-20s or early 30s. While the other three responses are true, it is the cognitive inhibitory brakes to control one's impulses that is lacking or still in development that best explains adolescent risk-taking behavior. Which of the following patients with generalized anxiety disorder is most likely to be a CYP2C19 poor metabolizer and have an exaggerated response to diazepam, Valium, 5 mg, TID, with increased sedation, central nervous system, and cognitive side effects? A. 50-year-old Caucasian male. B. 30-year-old African American male. C. 20-year-old African American female. D. 40-year-old Asian male. The correct answer is D. 40-year-old Asian male. The frequency of poor metabolizers of CYP2C19 is low among Caucasians, 3%, intermediate among African Americans, 18%, and higher in Asian and Japanese populations, up to 20%. Which of the following statements reflect the current understanding of dopamine, DA, pathways and clinical symptoms in schizophrenia? A. Negative symptoms are related to DA deficit in the mesolimbic system. Positive symptoms are related to DA excess in the substantia nigra and ventral tegmental area. B. Negative symptoms are related to DA deficit in the cerebral cortex. Positive symptoms are related to DA excess in the nucleus accumbens and mesolimbic system. C. Negative symptoms are related to DA excess in the cerebral cortex. Positive symptoms are related to DA deficit in the nucleus accumbens and mesolimbic system. D. Negative symptoms are related to DA excess in the mesolimbic system. Positive symptoms are related to DA deficit in the substantia nigra and ventral tegmental area. The correct answer is B. Negative symptoms are related to DA deficit in the cerebral cortex. Positive symptoms are related to DA excess in the nucleus accumbens and mesolimbic system. Negative symptoms and cognitive impairment are thought to be related to hypoactivity of the mesocortical dopaminergic tract, which by its association with the prefrontal and neocortex contributes to motivation, planning, sequencing of behaviors in time, attention, and social behavior. Positive symptoms of schizophrenia, hallucinations and delusions, are thought to be caused by dopamine hyperactivity in the mesolimbic tract, which regulates memory and emotion. This hyperactivity could result from overactive modulation of neurotransmission from the nucleus accumbens. Another explanation for dopaminergic hyperactivity in the mesolimbic tract is hypoactivity of the mesocortical tract, which normally inhibits dopamine activity in the mesolimbic tract by some type of feedback mechanism. In schizophrenia, the primary defect may be in the mesocortical tract, where dopaminergic function is diminished, thereby decreasing the inhibitory effects on the mesolimbic tract. Which of the following statements does not reflect current understanding of neurotransmitter pathways implicated in anxiety disorders? A. Increasing serotonergic activity in the amygdala diminishes symptoms of anxiety. B. Increased levels of CRF in the amygdala, hippocampus, and locus coeruleus increases symptoms of anxiety. C. Decreasing GABA in the mesolimbic cortex diminishes symptoms of anxiety. D. Decreasing norepinephrine in the locus coeruleus diminishes symptoms of anxiety. The correct answer is C. Decreasing GABA in the mesolimbic cortex diminishes symptoms of anxiety. GABA. Gamma-aminobutyric acid is the most abundant inhibitory neurotransmitter in the brain. Decreasing GABA would increase anxiety. Benzodiazepines are used to bind with GABA receptors to potentiate the anxiolytic, calming effects of GABA. The other responses are all accurate regarding effect on anxiety symptoms. Which of the following medications has a unique mechanism of action in that it is both a dopamine and norepinephrine reuptake inhibitor? A. Bupropion, Wellbutrin. B. Venlafaxine, Effexor. C. Imipramine, Tofranil. D. Duloxetine, Cymbalta. The correct answer is A. Bupropion, Wellbutrin. Bupropion boosts neurotransmitters norepinephrine, noradrenaline, and dopamine. Norepinephrine is a neurotransmitter that is implicated in alertness and anxiety. What part of the brain has a large majority of norepinephrine neurons? A. Amygdala. B. Locus coeruleus. C. Nucleus accumbens. D. Hippocampus. The correct answer is B. Locus coeruleus. There are two areas in the brain that produce norepinephrine neurons. One is the locus coeruleus and the other is the medullary reticular formation. You have a 17-year-old female patient who suffers with bipolar disorder. The patient has a history of impulsive acting out and promiscuity. You make a decision to add folic acid 0.8 mg to her medication regimen of lamotrigine, Lamictal, 200 mg orally at bedtime and quetiapine XR, Seroquel XR, 50 mg one orally at bedtime. Why is this important? A. The folic acid is important to help her with the sleepiness induced by her bipolar medications. B. The folic acid supports neural tube development during the first month that a woman is pregnant. C. The folic acid is important to help her with her hypotension induced by the quetiapine XR, Seroquel XR, 50 mg per QHS. D. The folic acid is important for the continuing development of the patient's neuroendocrine system. The correct answer is B. The folic acid supports neural tube development during the first month that a woman is pregnant. The patient's acting out behaviors may include sexual acting out. This could lead to pregnancy. The United States Preventive Services Task Force recommends that all women planning or capable of pregnancy take a daily supplement containing 0.4 to 0.8 milligrams, 400 to 800 micrograms, of folic acid. This recommendation is an A-level recommendation. The purpose is to lower the number of neural tube defects in fetuses. In evaluating a 4-year-old, one would expect which of the following delays in Asperger's disorder? A. Motor skills coordination. B. Social skills development. C. Cognitive development. D. Language development. The correct answer is B. Social skills development. Unlike autistic disorder, in Asperger's disorder, no significant delays occur in language, cognitive development, or age-appropriate self-help skills. The primary clinical features involve qualitative social impairment, markedly abnormal nonverbal communicative gestures, failure to develop peer relationships, the lack of social or emotional reciprocity, and an impaired ability to express pleasure in other person's happiness. Which of the following antidepressants is associated with dose-related cardiovascular adverse effects which require adherence to maximum recommended dosing, unless higher doses are deemed appropriate despite risks? A. Venlafaxine, Effexor. B. Mirtazapine, Remeron. C. Citalopram, Celexa. D. Sertraline, Zoloft. The correct answer is C. Citalopram, Celexa. Citalopram should no longer be prescribed at doses greater than 40 mg per day because it can cause abnormal changes in the electrical activity of the heart. Some controversy with FDA dosage limit of 40 mg per day, and higher doses may be prescribed by experts. A week after raising the dose of risperidone, Risperdal, a patient treated for schizophrenia presents to the clinic with reports of an acute change in mental status, fever, and rigidity. As the treating psychiatric mental health nurse practitioner, you know these symptoms are consistent with which of the following? A. Neuroleptic malignant syndrome, NMS. B. Extrapyramidal side effects. C. Anticholinergic withdrawal syndrome. D. Serotonin syndrome. The correct answer is A. Neuroleptic malignant syndrome, NMS. The patient is presenting with classic symptoms of NMS, acute mental status change, muscular rigidity, and autonomic instability. Which serotonin receptor antagonism makes an antipsychotic atypical? A. 5-HT4A. B. 5-HT2A. C. 5-HT3A. D. 5-HT1A. The correct answer is B. 5-HT2A. The mechanism of action that makes an antipsychotic medication atypical is related to the 5-HT2A receptor antagonism and D2 receptor antagonism. If given during pregnancy, lithium can cause which of the following medical problems in the baby? A. Spina bifida. B. Cleft palate. C. Neural tube defect. D. Ebstein's anomaly. The correct answer is D. Ebstein's anomaly. Lithium can cause Ebstein's anomaly in the infant if given to a pregnant woman. Which area of the brain has been implicated to modulate pain and can help explain how transcranial magnetic stimulation can help decrease pain? A. Dorsolateral prefrontal cortex. B. Insula cortex. C. anterior cingulate cortex. D. Prefrontal cortex. The correct answer is D. Prefrontal cortex. It has been shown that the prefrontal cortex modulates pain, and the perception of pain. Loss of gray matter has been associated with chronic pain, possibly due to a predisposition, or chronic medication use may be toxic to gray matter. When studying pharmacodynamics involving receptors, you know that an inverse agonist produces the following effect. A. Blocks the agonist from opening the channel, and does not activate a biological response. B. Causes the opposite effect of agonist, and causes the receptor to close the ion channel. C. Does not fully activate the receptor and causes only limited actions. D. Activates a biological response, and opens the ion channel. The correct answer is B. Causes the opposite effect of agonist, and causes the receptor to close the ion channel. Inverse agonists do the opposite of agonists. It causes the receptor to close the ion channel. Sandy, a 32-year-old separated female presents for an initial intake. Sandy states she recently left an abusive relationship, is living alone, and is experiencing fear, panic, and extreme anxiety. Which brain structure is activated in patients with severe anxiety, as expressed by Sandy? A. Hippocampus. B. Amygdala. C. Thalamus. D. Cingulate gyrus. The correct answer is B. Amygdala. The amygdala is important in mediation of fear, anxiety, and panic. Which of the following findings would raise concern in a preschool wellness exam for a 5-year-old girl? A. Pulse 102, respirations 30. B. Height 43 inches, weight 55 pounds. C. Blood pressure 92/52. D. Completed immunizations, MMR, varicella, DTaP, IPV, PVC, HIB, Hep B. The correct answer is B. Height 43 inches, weight 55 pounds. Body mass index, BMI, calculated for this height and weight is 21, which is greater than 95th percentile for her age, placing her in overweight category. Calculation. Weight divided by stature times 703 equals BMI. Or weight divided by stature times 10,000 equals BMI. A 74-year-old female presents for an evaluation. The psychiatric nurse practitioner has the patient complete the mini mental status examination and clock drawing. The patient is unable to correctly draw the face of the clock. Which area of the brain is likely to have compromised functioning? A. Wernicke's area. B. Corpus callosum. C. Left hemisphere. D. Right hemisphere. The correct answer is D. Right hemisphere. The right hemisphere of the brain is involved with recognition of facial expressions, music, and visual images. When the right hemisphere is compromised, there are disturbances in drawing, such as clock drawing. Patty is a 62-year-old white female with bipolar I disorder and has been stable for 2 years on valproate and risperidone. She was recently diagnosed with shingles, and her primary care nurse practitioner started her on corticosteroids. As the psychiatric mental health nurse practitioner treating Patty, You are concerned that the addition of the corticosteroids may cause A. Neuroleptic malignant syndrome. B. Stevens-Johnson syndrome. C. A manic episode. D. A hypertensive crisis. The correct answer is C. A manic episode. Corticosteroids have been known to be a pharmacologic cause of mania. Which of the following findings on MRI and PET scans would be uncommon in individuals with schizophrenia? A. Decreased glutamate and GABA release. B. Decreased total brain volume. C. Decreased size of cerebral ventricles. D. Decreased electrical activity in the frontal lobes. The correct answer is C. Decreased size of cerebral ventricles. Individuals with schizophrenia have enlarged cerebral ventricles. There is decreased electrical activity in frontal lobes, decreased glutamate and GABA release, and decreased total brain volume. Mr. Smith is a 56-year-old white male who has been successfully treated on selegiline for over 4 years. Mr. Smith is going in for an elective surgical procedure. Which medication is strictly contraindicated with selegiline? A. Morphine. B. Nonsteroidal anti-inflammatory drugs, NSAIDs. C. Meperidine. D. Codeine. The correct answer is C. Meperidine. Meperidine is strictly prohibited when a patient is treated on a monoamine oxidase inhibitor, MAOI, due to the risk of hypertensive crisis and death. A 43-year-old male is treated for bipolar I on lithium. Which of the following hematologic changes is associated with lithium? A. Anemia. B. Agranulocytosis. C. Leukocytosis. D. Leukopenia. The correct answer is C. Leukocytosis. While the mechanism of action is not clear, the use of lithium can raise white blood cell counts and, therefore, CBC should be monitored in patients treated on lithium. Your patient comes into the office for her middle-of-the-year appointment. She is diagnosed with bipolar I disorder. She has been maintained well for the past 3 years on oxcarbazepine, trileptal, 900 mg orally at bedtime. Her labs are normal except for a blood sugar of 114 and her hemoglobin A1C is 5.6. She has a normal energy level and states that her mood is stable but complains of excessive urination and thirst. You suspect A. Possible diabetes 2. B. Side effects of oxcarbazepine. C. Possible hyponatremia. D. Possible polydipsia. The correct answer is B. Side effects of oxcarbazepine. Oxcarbazepine, some side effects can come at the beginning or later in therapy. When the blood sugar is up but the hemoglobin A1C is normal, suspect the medication as the culprit. Your patient suffers from insomnia and bipolar disorder. She tells you that she likes to take her lurasidone 20 mg, Latuda, at bedtime because it is easier for her to remember. She does not like to gain weight, so she eats 2 90-calorie packages of ham slices with the lurasidone before she goes to bed. She complains of not being able to go to sleep very quickly. You respond A. I will increase the lurasidone dosage to 40 mg at bedtime to increase the soporific component. B. I recommend that you take in 360 calories of carbohydrates at bedtime to induce sleepiness. C. Increase the ham so that you are taking in 360 calories for full absorption. D. Improve your sleep hygiene and continue to eat the ham at bedtime. The correct answer is B. I recommend that you take in 360 calories of carbohydrates at bedtime to induce sleepiness. You must eat 360 calories of food to get proper absorption of lurasidone, Latuda. If you do not, you only get 1/2 of the medication absorbed into the body. In addition, protein tends to awaken people while carbohydrates tends to make them sleepier. Turkey is the exception because it contains tryptophan. Which of the following statements most accurately reflects the predominant risk factors of antisocial personality disorders? A. Lower socioeconomic status from single-parent families. B. Genetic predisposition of first-degree family member. C. Gang affiliation and early substance abuse. D. Childhood abuse and trauma from domestic violence. The correct answer is B. Genetic predisposition of first-degree family member. Antisocial personality disorder is 5 times more common among first-degree relative of men with the disorder than the general population, making genetic predisposition the greater risk factor. Concordance rates for monozygotic twins are much higher. A 53-year-old man presents to the emergency department with complaint of sore throat progressively worsening for 3 days with intermittent fever. In triage, he tells the RN that he has taken ibuprofen 400 mg 4 hours ago for the pain, and currently his vital signs are blood pressure 120/80, heart rate 88, respiratory rate 12, SP02 96% on room air. While waiting for the results of the rapid strep test, the patient becomes agitated, restless, confused, and increasingly difficult to redirect. He is transferred to the psychiatric emergency department because it is a locked unit. Which of the following is the most likely diagnosis? A. Presenile dementia. B. Personality disorder. C. Mixed delirium. D. Mood disorder. The correct answer is C. Mixed delirium. Mixed delirium is characterized by a cyclical manifestation of psychomotor retardation and agitation with a disturbance in consciousness. Risk factors include infectious process, fever, and relocation. Dementia is a slowly progressive process that impairs cognition with the preservation of level of consciousness. Personality disorder is characterized by a historical pattern of rigid maladaptive coping mechanisms that cause distress. Mood disorder is a diagnosis of exclusion in which there are an insufficient number of symptoms to meet full criteria for major depressive disorder, bipolar disorder, or generalized anxiety disorder. Karen is a 68-year-old former legal secretary who enjoys an active social life with her husband. She feels she has something wrong with her medically and has seen many specialists over the year who have found nothing wrong with her. Her husband reports that she continually repeats the same 5 stories over and over again as if she is telling them for the first time. On 2 occasions in the last year, she has gotten lost coming home from the supermarket and was found by the police a half-mile from her former place of employment. What is the most likely diagnosis? A. Vascular dementia. B. Huntington's disease. C. Creutzfeldt-Jakob disease. D. Mixed delirium. The correct answer is A. Vascular dementia. vascular dementia, is the second most common dementia caused by progressive cardiocerebrovascular disease. Huntington's disease is a subcortical disease characterized by motor abnormalities and cognitive decline. Pick's disease is also known as frontotemporal dementia, and Culver-Bucy syndrome is characterized by uninhibited cheerfulness, hypersexuality, and hyperorality. Mixed delirium is a cyclical manifestation of psychomotor retardation and agitation with a disturbance in consciousness. Risk factors include infectious process, fever, and relocation. Which type of dementia is characterized by a gradual onset and progressive decline without focal neurological deficits? A. Alzheimer's disease. B. Pick's disease. C. Vascular dementia. D. Huntington's disease. The correct answer is A. Alzheimer's disease. Alzheimer's disease is the most common type of dementia, followed by Pick's disease, Culver-Bucy syndrome, vascular dementia, and Huntington's dementia. Alzheimer's is characterized by gradual onset and progressive decline without focal neurological deficits. A 72-year-old man with a history of hypertension and type 2 diabetes mellitus has become increasingly disinhibited and flirts with his home health aide. He demands she kiss him, or he will pee on himself. She is sometimes able to distract him with cookies, but his children often object because it will worsen his blood sugar control. Which of the following is the most likely diagnosis? A. Alzheimer's disease. B. Frontotemporal dementia. C. Vascular dementia. D. Creutzfeldt-Jakob disease. The correct answer is B. Frontotemporal dementia. Pick's disease is also known as frontotemporal dementia, characterized by a change in personality and cognitive decline. A subtype is Culver-Bucy syndrome, manifested by uninhibited cheerfulness, hypersexuality, and hyperorality. The PMHNP is consulted to see a 70-year-old female who was admitted to the skilled nursing facility 3 days ago from the hospital where she was treated for urinary tract infection, pneumonia, and dehydration. The staff reports that the patient is restless and agitated, awake most of the night, intermittently sleeping during the day, and has poor per-oral intake. What should the PMHNP do first? A. Prescribe quetiapine 12.5 mg orally at bedtime and every 6 hours as needed for agitation. B. Physical exam and diagnostic tests, complete blood count, basic metabolic profile, and urinalysis. C. Transfer the patient to the ED. D. Call family members for collateral information on her baseline functioning. The correct answer is B. Physical exam and diagnostic tests, complete blood count, basic metabolic profile, and urinalysis. Physical exam and diagnostic tests are used to rule out delirium given the patient's history, age, and clinical presentation. Prescribing medication can worsen delirium and mask symptoms of an underlying cause. Transferring the patient to the ED may worsen or trigger delirium. Obtaining collateral information is helpful in helping to establish a baseline pattern of function, but the acute problem of delirium must be addressed and ruled out first. A 66-year-old woman employed as a federal appeals lawyer is being seen by the PMHNP, accompanied by her son, who has been concerned about progressive memory problems. Which of the following would be most helpful in distinguishing between common forgetfulness and cognitive impairment? A. Brain MRI with and without contrast. B. Montreal Cognitive Assessment, MoCA. C. family history. D. Hamilton Depression Scale, HAM-D. The correct answer is B. Montreal Cognitive Assessment, MoCA. The Montreal Cognitive Assessment is a psychometrically validated screening tool for mild cognitive impairment, including visuospatial abilities, short-term recall, trail-making, attention, concentration, language, and orientation. A 42-year-old male with alcohol use disorder for 5 years is referred to the PMHNP from his primary care provider for addiction treatment. Which of the following laboratory findings would be consistent with his diagnosis? A. Increased urine and serum creatinine levels. B. Increased mean corpuscular volume and triglycerides. C. Increased potassium and chloride levels. D. Decreased mean corpuscular volume and normal triglyceride level. The correct answer is B. Increased mean corpuscular volume and triglycerides. Elevated mean corpuscular volume, MCV, and triglycerides are conventional biomarkers of heavy drinking, but elevated urine and serum creatinine levels are not suggestive of renal disease. Decreased MCV and normal triglycerides are nonspecific findings consistent with microcytic anemia. The purpose of a professional organization's scope and standards of practice is to A. Define the role and actions for that particular profession. B. Define the differences between professions. C. Establish the legal authority to practice for a profession. D. Define the legal statutes that are governing a profession. The correct answer is A. Define the role and actions for that particular profession. The scope and standards, dictated by professional organizations, define the role and actions of a particular profession. The government-appointed professional boards to define the differences between professions, establish criteria for licensure, and define the legal statutes that govern a profession. An APRN recognizes the essential nature of primary prevention strategies for a community. Which of the following is an example of a primary prevention strategy? A. A skills class for at-risk adolescents. B. A suicide hotline. C. Mandated treatment. D. A psychosocial clubhouse for the mentally ill. The correct answer is A. A skills class for at-risk adolescents. Skills class for at-risk individuals is an example of primary prevention. The suicide hotline is an example of secondary prevention because a specific condition with specific interventions is aimed at reducing specific risk outcome. Mandated treatment and psychosocial clubhouse are tertiary prevention strategies because they are aimed at proving outcomes and reducing symptoms of a condition that has already occurred. Which of the following is representative of legal ruling trends over the past 30 years? A. Juries have been encouraged to find defendants not guilty because of insanity. B. People with mental illness retain their inalienable rights even when committed to a mental hospital. C. Courts place increased trust in the professional judgment of mental health care providers to make ethical decisions. D. The time in bringing cases before a magistrate for commitment hearings has been reduced. The correct answer is A. Juries have been encouraged to find defendants not guilty because of insanity. The person has a diagnosed mental disorder and poses harm to self or others as a result of the disorder, and treatment is likely to improve functioning. It is not sufficient for the patient to be unwilling or unable to accept the nature and severity of a mental disorder without having been diagnosed. the harm stems from the diagnosed condition, and treatment is likely to improve the condition. The patient's threat and risk level must be as a result of a diagnosed mental disorder. A history of serious mental illness that is currently untreated is insufficient for involuntary admission if they are not a threat as a result of the disorder at the present time. A patient who has been voluntarily committed is experiencing symptoms of psychosis. He declares he has the right to refuse his medications despite the court order because God told him he would be healed by his faith alone. Based on your knowledge of court-ordered treatment, which of the following statements is true? A. Psychiatric clients cannot refuse treatment. B. Psychiatric clients can refuse treatment unless it is court-ordered. C. Psychiatric clients cannot act in their own best judgment. D. The professional judgment of the PMHNP supersedes the client's right to refuse medication. The correct answer is B. Psychiatric clients can refuse treatment unless it is court-ordered. The court order trumps the patient's right to exercise self-determination, and the patient cannot refuse treatment unless the condition threatens life or limb. Professional judgment of two physicians is sufficient unless there is an imminent threat. Which of the following elements is reflective of a professional relationship rather than a social relationship? A. In a professional relationship, there is no place for social interactions. B. In a professional relationship, the PMHNP is solely responsible for making the relationship work. C. In a professional relationship, the primary focus is on the client and their needs. D. In a professional relationship, goals are left vague so that the client feels any issue can be discussed. The correct answer is C. In a professional relationship, the primary focus is on the client and their needs. Professional relationships should focus on the client's needs and outcomes, and should not give advice based on personal experience. The PMHNP should not exploit the therapeutic relationship for personal favors. In light of the recent school shootings, the local high schools have noticed an unusually high incidence of depressive symptoms and illicit drug use among their students. The PMHNP formulates a plan to address the problem. The goal of the program is to enhance the capabilities of families and teachers to identify antecedents of depression and drug use to prevent new cases from developing. What level of prevention is this strategy? A. Tertiary prevention. B. Secondary prevention. C. Solution-focused prevention. D. Primary prevention. The correct answer is D. Primary prevention. Primary prevention aims to reduce the incidence of a disease or condition. Secondary prevention aims to detect the presence of a condition early and prevent it from getting worse. Tertiary prevention aims to enhance the quality of life after the disease or condition has occurred. Solution-focused therapy is a counseling approach that assumes the individual has the capacity to articulate a problem and offer solutions. A 45-year-old white female agreed to hospitalization after presenting to the emergency department with passive suicidal ideations. After 24 hours, she states that she wishes to leave because this place cannot help her. Which of the following actions reflects the legal right of the client? A. The patient should be discharged immediately. B. The patient is discharged after she signs forms indicating her actions and acknowledge her actions are against medical advice. C. Contact a collaborating physician to convert the patient to an involuntary status. D. Explain that the patient cannot leave until further assessments are completed and collateral. The correct answer is D. Explain that the patient cannot leave until further assessments are completed and collateral. Explain the patient cannot leave until further assessment and collateral information is obtained with the aim of seeing if she will agree to remain on a voluntary basis. Discharging the patient immediately without further information may increase the risk of suicide. Before the patient signs out against medical advice, further assessment is required for capacity to refuse care. Converting the patient to involuntary status requires further assessment. A 50-year-old physician presents with complaints of fatigue, headache, abdominal distress, and weight loss. His husband reports increasing irritability, inattentiveness, and low libido over the last month. He was seen by his primary care provider, who just notified him he had prediabetes, hypercholesterolemia, and hypertension despite weight loss. These findings are most consistent with A. Dysthymia, B. Major depression, C. Generalized anxiety disorder, D. Seasonal affective disorder. The correct answer is B. Major depression. Major depressive symptoms include sleep changes, interest loss, guilt, energy deficit, cognitive impairment, appetite change, psychomotor agitation, retardation, and somatic complaints often comorbid with type 2 diabetes.